In tonight's 7 UpFront report, we're taking a closer look at COVID-19 vaccines, Pfizer and Moderna, with vaccines that are more than 90% effective. Within days, test results could be submitted to the FDA for emergency authorization for public use. Joining me now is Dr. Sam Sun, the director of the nonprofit InDemic Foundation. Dr. Sun, thank you for your time tonight and being here for us.
No problem. Thank you for having me.
Let's talk about the two most promising vaccines that could be approved very soon. What's being done to make sure they're safe? And should the public get in line for a vaccine if these are approved?
So the vaccine trials were both set up with 30,000, or in Pfizer's case, 44,000 participants, and detailed safety data has been collected for the participants in the trials. Both vaccines are very well tolerated. No serious adverse events were detected, serious adverse events being extended hospitalizations, ICU admissions, or deaths. And in addition, the side effect profile for both vaccines is very good. So only 4%, or in Moderna's case, about around 9% of participants had what we consider grade 3 or severe adverse events or side effects, and that's a very good side effect profile. So you might have a little bit of fatigue, you might have some mild muscle pain after a vaccination, but that's about it.
What can you tell us about the challenges of distributing the vaccine, particularly this Pfizer vaccine, which we understand must be kept at extremely cold temperatures?
Right. So both vaccines are based on RNA, and RNA is not that stable. Moderna has reported that their vaccine can be stored at fridge temperatures, so 2 to 8 degrees Celsius for 30 days, and long-term at negative 20 degrees Celsius or freezer temperatures. So that's very encouraging. And then Pfizer seems confident in their existing distribution channels. So even though they do require minus 70 degrees Celsius, they have special temperature-controlled containers that should be able to get their vaccine to the participants and people who need it most.
When is the earliest we could realistically have a vaccine at doctors' offices and pharmacies available to us, the general public?
Right. So there have been a number of studies over the last few months and sort of consensus guidelines around who should receive the vaccine first and what the rollout process should look like. I don't know that either Pfizer or Moderna has finalized plans regarding rollout of their vaccines, but in general, it's thought that healthcare workers, frontline workers, and then adults at highest risk of having severe COVID-19, so those with comorbidities such as diabetes or heart disease, or those over age 65 will be prioritized. And I would say after those groups are vaccinated, there will be a rollout to the general public. We anticipate that rollout to the general public should occur in early 2021.
Sooner the better, right? Given the rising numbers that we're seeing of infections. So, Doctor, do we know how long the vaccine will last, for instance? And you mentioned, temporary reaction to it, but any long-term effects from these vaccines that we would want to know about?
Sure. So, unfortunately, the vaccine trials have only been run for the last 6 months or so. So, long-term, we don't really know, first of all, whether the vaccine will provide long-term protection. We know that they provide protection over a few months, and the data is strong enough that both Pfizer and Moderna are going to submit to the FDA for approval. But right now, just because the pandemic is so new compared to other viruses that we've lived with for decades, we just don't know whether the vaccines will protect against COVID-19 for 2, 5, 10 years. That's just data that we don't have.
Yeah. And we know there are people out there who won't get a vaccine, understanding that. Will the coronavirus ever be contained? And if not, what should people know about protecting themselves into the future?
Right. I think for the near future, while the vaccines are still being rolled out, it's still very important to adhere to public health measures such as social distancing and masking. So as people gather for Thanksgiving and Christmas, the more people can gather virtually rather than in person to slow the spread of the coronavirus. That's very important. Even from now until the initial rollout of the vaccine, many more people could develop COVID-19, many more people could be hospitalized and develop complications of COVID-19. So those public health measures are still very important. And I would say that as for people who are not as enthusiastic about getting the vaccine, I think we'll see a wave of adoption as millions of frontline workers and healthcare workers get the vaccine, as higher risk adults get the vaccine, and we see that it's safe. We are hopeful that the rest of the public, perhaps those that have some vaccine hesitancy, as we call it, will be more encouraged to get vaccinated as well.
Excellent information, Doctor. We appreciate your time tonight. Dr. Sam Sun joining us on UpFront tonight. Stay safe, Doctor. Thank you.